friends. I am Annie, your friendly health coach. Today, I would like to talk to you about how we can get our blood pressure under control. But first, let us look at the symptoms and causes of high blood pressure. You may be wondering what hypertension or high blood pressure is. Hypertension, or what we call high blood pressure, is when the pressure in your blood vessels is too high. The level is 140 over 90. If you have normal blood pressure, your blood pressure is below 120 over 80. Make sure you lead an active lifestyle and eat a healthy diet to maintain this level. People with high blood pressure may not feel any symptoms, but it can damage the blood vessels, unnoticed, and lead to serious health problems. The only way to find out is to have your blood pressure measured, as there is no cure. But if you take the prescribed medication and change your lifestyle, you can improve your quality of life and control your blood pressure. These measures can also reduce your risk of heart disease, stroke, kidney disease, and many more. Now, let us look at the symptoms of high blood pressure. Very high blood pressure can cause headaches, blurred vision, chest pain, and other symptoms. If high blood pressure is not treated, it can lead to other health problems such as kidney disease, heart disease, and stroke, as I mentioned in my introduction. People with very high blood pressure may have severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision, or other vision changes. They can also experience anxiety, confusion, buzzing in the ears, nosebleeds, and abnormal heart rhythm. If you experience any of these symptoms and have high blood pressure, you should see a doctor immediately. The only way to detect high blood pressure is to have your blood pressure measured by a doctor. Taking blood pressure is quick and not painful. Although individuals can measure their own blood pressure with automated devices, a doctor's assessment is important to evaluate the risks and associated conditions. There are many factors that can increase your risk of high blood pressure. For example, unhealthy diets, especially a diet high in sodium. For good health, you need good nutrition from many sources. A healthy diet can help lower blood pressure. A diet that contains too much sodium or salt, calories, saturated and trans fats, and sugar can increase the risk of high blood pressure. Another risk factor is being overweight or obese. Too much weight puts extra strain on your cardiovascular system. This can cause serious health problems and increases your risk for cardiovascular disease, diabetes, and of course, high blood pressure. The other one is, you understand, do not smoke. Smoking raises your blood pressure and puts you at a higher risk for heart attack and stroke. If you don't smoke, don't start. If you do smoke, quitting will lower your risk for heart disease. Your doctor can suggest ways to help you quit. Another risk factor is women who have high blood pressure during pregnancy are more likely to have high blood pressure later in life. My other factor is high blood pressure is more common in black adults than in white, Hispanic, or Asian adults. Compared with other racial or ethnic groups, black people tend to have higher average blood pressure numbers and get high blood pressure earlier in life. Another one is some medicines can make it harder for your body to control your blood pressure. For example, antidepressants and decongestant medicines to relieve staphylos, hormonal birth control pills, and non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen can all raise your blood pressure. Then next one is drinking too much alcohol, like regular heavy use of alcohol can cause many health problems and cause your blood pressure to increase. Stress is another factor. Stress is not always bad, but too much stress can lead to increased blood pressure. Too much stress can lead to behaviors that can increase blood pressure, such as poor diet, not engaging in any physical activity, the use of tobacco, and drinking too much alcohol than usual. Family history also plays a role. If your parents or other close blood relatives have, have high blood pressure, you have an increased chance of getting it too. Another risk factor is your age. As you get older, you are more likely to get high blood pressure. As we age, our blood vessels gradually lose some of their elastic quality. This can cause increased blood pressure. However, children can also develop high blood pressure. All the factors I have mentioned can increase your blood pressure, but there are some factors that you can influence, such as unhealthy lifestyle habits. Other risk factors such as age, family history and genetics, race and ethnicity, and gender cannot be changed. However, you can take steps to reduce your risk of high blood pressure and its complications. Talk to your doctor about how to manage your blood pressure and whether medication might help. Lifestyle changes can help lower high blood pressure and can help anyone with hypertension. Many who make these changes will still need to take medicine. If you have high blood pressure, you may wonder if medication is necessary to bring the numbers down. But lifestyle plays a vital role in treating high blood pressure. I'll be giving you many tips that will help you control your blood pressure. Controlling your blood pressure with a healthy lifestyle might prevent, delay, or reduce the need for medication. Number one, eat a healthy diet. Eating a healthy diet rich in whole grains, fruit, vegetables, and low in saturated fat and cholesterol can lower your high blood pressure. Number two, limit processed food. Processed foods are often high in salt, added sugar, and unhealthy fat. They may lead to weight gain. All these factors can contribute to high blood pressure. As examples include processed meat, many fast or fried foods, processed snacks, foods labeled low fat may be high in salt and sugar to compensate for the loss of fat. Fat is what gives food taste and makes you feel full. Eating less processed food will help you eat less salt, less sugar, and fewer refined carbohydrates. All of this can result in lower blood sugar. Number three, manage your weight. Having additional body weight puts a strain on the heart and the cardiovascular system. Blood pressure often increases as the weight increases. Being overweight also can cause disrupted breathing while you sleep, like sleep apnea, which further raises blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. If you're overweight or have obesity, losing even a small amount of weight can help reduce blood pressure. The three key ways of doing this are to move more, eat less, and eat healthy. Number four, cut back on sugar and refined carbohydrates. Restricting sugar and refined carbohydrates may help you lose weight and lower your blood pressure. Number five, exercise regularly. Regular exercise means you regularly increase your heart and breathing rate. Over time, your heart gets stronger and pumps with less effort. This puts less pressure on your arteries and lower your blood pressure. Tips for increasing your activity levels include using the stairs, walking instead of driving, doing household chores, gardening, going for a bike ride, or playing a team sport. Regular physical activity can lower high blood pressure. It's important to keep exercising to keep blood pressure from rising again. As a general goal, aim for at least 30 minutes of moderate physical activity every day. Exercise can also help keep elevated blood pressure from turning into high blood pressure, which we call hypertension. For those who have hypertension, regular physical activity can bring blood pressure down to safer levels. Some examples of aerobic exercise that can help lower blood pressure include walking, jogging, cycling, swimming, or even dancing. Talk to a healthcare provider before you start any kind of exercise. Number six, reduce salt in your diet. Even a small reduction of salt in your diet can improve your heart health and reduce high blood pressure. To reduce salt in the diet, read food labels, look for low sodium versions of foods and beverages. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add salt. Use herbs or spices to add flavor to food. Cooking your own food lets you control the amount of sodium in the food. Number seven, limiting alcohol consumption or quitting can help lower blood pressure. Drinking too much alcohol can raise your blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. Number eight, quit quit smoking. Smoking raises your blood pressure and puts you at higher risk for heart attack and stroke. If you don't smoke, don't start. If you do smoke, quitting will lower your risk for heart disease. Number nine, get a good night's sleep. Poor sleep quality, getting fewer than 6 hours of sleep every night for several weeks, can contribute to hypertension. A number of issues can disrupt sleep, including sleep apnea, restless leg syndrome, and general sleeplessness or insomnia. Let your healthcare provider know if you often have trouble sleeping. Finding and treating the cause can help improve sleep. However, if you don't have sleep apnea or restless leg syndrome, follow these simple tips for getting more restful sleep. Stick to a sleep schedule. Go to bed and wake up the same time each day. Try to keep the same schedule on weeknights and on weekends. Create a restful space. That means keeping the sleeping space cool, quiet, and dark. Do something relaxing in the hour before bedtime. That might include taking a warm bath or doing relaxation exercises. Avoid bright light, such as from a TV or computer screen. Watch what you eat and drink. Don't go to bed hungry or stuffed. Avoid large meals close to bedtime. Limit or avoid nicotine, caffeine, and alcohol close to bedtime as well. Limit naps for those who find napping during the day helpful. Limiting naps to 30 minutes earlier in the day might help nighttime sleep. Number 10, reduce stress. Long term or chronic emotional stress may contribute to high blood pressure. However, it can help to determine what causes stress, such as work, family, finances, or illness, and find ways to reduce stress. Try the following. Avoid trying to do too much. Plan your day and focus on your priorities. Learn to say no. Allow enough time to get done what needs to be done. Focus on issues you can control and make plans to solve them. Avoid stress triggers. For example, if rush hour traffic causes stress, travel at a different time or take public transportation. Please avoid people who cause stress if possible. Make time to relax. Take time each day to sit quietly and breathe deeply. Make time for enjoyable activities or hobbies such as taking a walk, cooking, or volunteering. Number 11, monitor your blood pressure at home and get regular checkups. Home monitoring can help you keep tabs on your blood pressure. It can make certain your medications and lifestyle changes are working. Home blood pressure monitors are available widely and without a prescription. Talk to a healthcare provider about home monitoring before you get started. Regular visits with a provider are also key to controlling blood pressure. If your blood pressure is more controlled, ask your provider how often you need to check it. You might be able to check it only once a day or less often. Number 12, and my last tip, of course, get support. Supportive family and friends are important to good health. They may encourage you to take good care of yourself, drive you to the care provider's office, or start an exercise program with you to keep your blood pressure low. If you need support beyond your family and friends, consider joining a support group. This may put you in touch with people who can give you an emotional or moral boost and who can offer practical tips to cope with your condition. If your blood pressure is very high or doesn't decrease after making these lifestyle changes, your doctor may recommend prescription drugs depending on your blood pressure level and other factors. Talk with your doctor about possible medications and what might work best for you. Contact your doctor with any questions or concerns about high blood pressure. Always consult your doctor first if you have any health concerns, and don't forget to take good care of yourself. If you have any questions or comments, please leave them below. If you enjoyed this video, please remember to follow my page and share it with your friends. Thank you and bye.